Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
Part 3, and then you're going to be a wellness blood work expert. We're going to talk about thyroid and urine testing, and they don't really actually specifically go together. It's just when you get the blood back from the lab, whether you run it in-house or send it out, then usually the first thing you see is the CBC, the second thing you see is the chemistries with the electrolytes, then you see the thyroid, and then you see the urine. So that's kind of why we're doing it in this order. Plus, it also helps break it up so it's not like a 14-hour long podcast. So thyroid hormones, they do a lot of stuff. They regulate heat production in the body. They regulate metabolism of carbohydrates, fats, and proteins. They help increase your sympathetic nervous response. So that's your fight or flight. So you have your sympathetic, which is your fight or flight, and then you have your parasympathetic, which we call the rest and digest. So your thyroid hormone helps your body handle that fight or flight. And then also improves blood flow to a lot of organs, especially the kidneys. So the total T4, or T4, is actually thyroxine, and it's the main circulating form of thyroid hormone found in the blood. And for dogs and cats, the total T4 is our screening test. And in people, it's the TSH, or thyroid stimulating hormone. And so if your doctor thinks that your thyroid is wonky, then the first thing they're going to do is run a TSH. And if it's abnormal, then they're going to do additional testing. So in veterinary medicine, if we think the thyroid's wonky, then we're going to run a T4. And then if that's abnormal, depending on the animal, we may need to run additional tests. Or in the case of cats, because they're aliens, if it's borderline, then we may need to run additional tests. So we're going to talk about dogs first. Thyroid disease in dogs is almost always hypothyroidism or low thyroid levels. We typically only see hyperthyroidism or high thyroid levels if there's actually a tumor of the thyroid gland, and usually those don't actually even produce enough thyroid hormone to elevate it, but occasionally we see it. So a low total thyroid can be due to a number of things. You could actually have true hypothyroidism. You could have what's called euthyroid illness or euthyroid sick. And that means that there's other things that are causing, or other diseases or factors going on that cause that thyroid or that total T4 to be artificially low. Breed variation, sighthounds actually have a normally lower T4. Certain medications like steroids, sulfa antibiotics, phenobarbital, and aspirin can artificially lower the thyroid. Dogs that are put on phenobarbital, which is an anticonvulsant, once they're on phenobarbital, it's like impossible to determine if they're actually truly hypothyroid because it just throws off the whole thyroid panel. Pregnancy and being in heat can also reduce your thyroid. So hypothyroidism can be congenital or it can be acquired. And most cases of hypothyroidism are actually acquired, and they're due to destruction of the thyroid gland, either just because or for an immune-mediated reason. And in people, Hashimoto's thyroiditis is the name for like an immune-mediated thyroid disease. So clinical signs of low thyroid. You can see skin and fur changes, and that's probably one of like the first ones that we think about. Their coat can be dry and brittle. They can have fur loss. They can have like weirdly puppy-like fur. It's very strange. Almost like downy. And sometimes they can get darker pigmentation of the skin, thickening of the skin, which we call lichenification. The darker pigmentation is hyperpigmentation or hyperkeratosis, and oily skin or seborrhea. And sometimes it can have oily fur. You can see scaling or dandruff as well. You'll get these recurrent low-grade skin infections and recurrent low-grade yeast infections, frequently in the ears. And you can also have a propensity for a non-contagious form of mange called Demodex. You'll also notice that they don't heal well, and sometimes we say they have a dull mentation, right? So they're just like not as energetic or responsive. It doesn't necessarily mean they're not smart. It just means they just aren't as excited, like, yay. They're cold intolerant, so they're frequently cold. They have less energy. They can have what's called a peripheral neuropathy, so they can have weakness or walk strange or decreased sensation. The sensation is hard for us to tell in veterinary medicine. You can also see incoordination. They can get Bell's palsy, which is facial nerve paralysis, and they can also develop seizures. The seizures is most commonly associated with like the congenital form. Megaesophagus, which is a giant dilation of the esophagus that basically extends the entire length of the esophagus, and it means that the esophagus isn't working. And we always want to tie megaesophagus to hypothyroidism. And so anytime we see it, we always test for it. And like, for some reason, we just can't let go of it. But I don't think that there's actually significant documentation proving that low thyroid causes megaesophagus. On blood work, you'll see the cholesterol can be high, the triglycerides can be high, and sometimes they'll have a slow heart rate or a mild non-regenerative anemia. So that is where the bone marrow doesn't really realize that the body's anemic. And you can actually sometimes see a mild elevation in the SDMA, and that is because your thyroid helps improve blood flow to your organs, and one of your major organs that needs a lot of blood flow are your kidneys. So if your thyroid is not functioning as well, then you're going to have reduced blood flow to your kidneys. Maybe not enough to see that spike in the BUN and creatinine, right? Because that you have to have 75% of your kidneys mucked up before you see that, but enough that maybe 25% of your kidneys are affected, and so you'll see the SDMA start to rise. So we get a total T4 that's low, and we think, this dog may actually be hypothyroid. So what do we do next? Well, we can run additional tests, and my preferred method is to send additional blood off to Michigan State. So they have the MSU, or Michigan State University Thyroid Panel, and it's the laboratory associated with the veterinary school, and it'll test all these things we're getting ready to talk about. So it'll test the T3, which is the triiodothyronine, and honestly, like, I've tried to do that 5 times with a retake, but I just can't say it quickly. So you can test the T3 levels. That's another form of thyroid hormone, and it's actually what T4 becomes when it's in circulation. So your T4 is released by your thyroid, and then it becomes your T3. And actually, T3 is 3 to 5 times more potent than your T4. But sometimes the measurement is not as accurate, and or you may not see it as much, so it's easier just to start with your T4. Your free T4, which is actually the metabolically active form of T4, that TSH, or that thyroid stimulating hormone that we start with in people, and it should actually cause the T4 and T3 to be released by the thyroid gland. So if you have a low T4 and a high TSH, right, so not enough thyroid hormone and too much thyroid stimulating hormone, that is very supportive of being hypothyroid or low thyroid, because the TSH is like, come on, but the thyroid gland just doesn't have anything to give. You can also actually test for the thyroglobulin antibodies. So they're called anti-thyroglobulin antibodies, and these are antibodies against the thyroid gland, and if they're high, then it proves that there's an immune-mediated component. Sometimes people don't have the funds to do the additional testing, and you're like really suspicious that they are actually hypothyroid. So it is reasonable to do a drug trial. So you start them on thyroid hormone supplements, and you see if their clinical signs improve, as well as recheck their total T4 later on. And again, it's not what we would call quote unquote gold standard, but life is not gold standard sometimes. So if, it quacks like a duck, walks like a duck, and you treat it like a duck, then sometimes, I don't really know where this analogy goes from here. Sometimes it becomes a swan. I don't know. So I have done it. It's not my, first choice method. But again, if finances are an issue, then it's always worth trying, because it's very hard to actually hurt a patient by giving them thyroid hormone. So once we've started the medication, whether it's because we've confirmed a diagnosis or because we're doing the drug trial, about a month into it, we're going to want to ideally repeat that thyroid panel. So for me, I send it back to Michigan State. And if they are clinically doing well, then at 6 months, and then from then on annually, you can just check the total T4. Because we used to always do the panel, and what we found is that if clinically they're doing well and their total T4 is within therapeutic range, and we actually check it 4 to 6 hours post-pill, okay, so we want to see peak effect, then you don't have to do the full panel. But if you're doing any sort of medication adjustments, or the patient is not doing well clinically, then you're going to want to run the full panel. So that's dog thyroid. Let's talk about cat thyroid. So cat thyroid disease is almost always hyperthyroidism, or too much thyroid hormone. And in the initial diagnosis is an elevated total T4 on your baseline blood work. And if it's truly elevated, then it's diagnosed. You don't have to do any more testing, and you can start them on medication. If the T4 is in what we call the gray zone, then you have to run a second test, and usually that's a free T4, which we said was the metabolically active form of the total T4, in order to confirm if they're hypothyroid. And if the free T4 is high and the total T4 is in the gray zone, then they're hyperthyroid. If the free T4 is normal and their total T4 is in the gray zone, either they're going to be hyperthyroid and they're just not yet, or they're not hyperthyroid. And the free T4 is actually going to elevate before the total T4. But again, it's easier and less expensive to run the total T4 first. Most hyperthyroid cases have a benign enlargement of the thyroid gland. So you'll have what's called a thyroid slip. So sometimes you'll see us like lift their neck or lift their chin and then rub our fingers on either side of the neck. What we're feeling for is a thyroid slip. So signs you see in cats with hyperthyroidism. So you'll see weight loss, diarrhea, vomiting, increased hunger, increased thirst and urination. Sometimes you see weakness and hyperactivity. You'll see increased vocalization, especially at night. So I have a 16-year-old cat, and he has hyperthyroidism, and he is a challenge to regulate. And he screams all the time. And he's also always hungry and always puking and always thirsty and always peeing. It's almost like he's like tweaking nonstop. Like he's like Tweak from South Park. I think this is the second time I've referenced South Park. So my toddler actually thinks cats are called yows because all he does all night long is yow, yow. So he calls every cat that he sees a yow. So if you have a cat that's like kind of skitsy, always hungry, vomiting a lot, losing weight, then you got to think hyperthyroidism. You can also see lethargy or decreased appetite and a palpable goiter, which is that thyroid enlargement. Sometimes they'll have muscle weakness or loss of muscle tone. You can see what's called cervical ventroflexion or curving down of the neck. They'll get like a poor, unkempt hair coat. And you may see like patchy hair loss, especially if they're over grooming. It's slow for the coat to grow back. And they'll get these like giant claws because they get increased nail growth. They can also have heart changes because too much thyroid hormone is actually toxic to the heart. So their heart rate goes up, they can get a murmur, they can get a gallop rhythm, and they can get other different rhythms. A gallop rhythm is literally what it sounds like. Like if you imagine Monty Python's the guy like following him around with the coconuts, like that's what it sounds like. Sometimes you can see coughing, especially if there's heart failure, panting or trouble breathing, again with heart failure. And they're cold a lot. So when I was a kid, we had a cat that was hyperthyroid, and she would puke all the time. Her name was Beanie. And so my parents nicknamed her Bulimic Beanie because all she did was vomit. And then as she got older, like her hair coat got like really stringy, and then she kept sticking her head under the lamp, under the lampshade, like to be next to the lamp. And this is, before we have like LED or fluorescent bulbs. So, they're actually hot. So I was always worried she was going to burn herself. And sure enough, she was hyperthyroid. And so if, in the back of your mind, if your kitty is older, puking a lot all of a sudden, losing weight, we always want to think, sure, diabetes, kidney disease, and hyperthyroidism. Like those are like your primary kind of suspicions. And all of that information is going to be obtained by running baseline or wellness blood work. So when we look at the blood, there's things that we can see consistent with hyperthyroidism, but it's not diagnostic, right? The only way to diagnose it is with that total T4 and or the free T4. So you can see hemoconcentration, which is that increase in the red blood cell count. You can see a stress leukogram. So that is the total white blood cell count's normal. Your neutrophils, which are your bacteria fighting white blood cells, are elevated. Your lymphocytes are low, and your eosinophils are low. You can sometimes see mildly elevated liver enzymes, so like the ALT, the ALP, or the AST. That one I don't see as much. It's usually the ALT, although in the last 2 years, I've had a string of cats with an elevated ALP with hyperthyroidism when I used to classically think elevated ALT. They can have mild chronic kidney disease, and that's not necessarily because they're hyperthyroid, right? Because your thyroid hormone is going to increase blood flow to the kidneys, but most of your cats that are hyperthyroid are in their teens. And the chance of them having kidney disease goes up exponentially as they get older. So it's very common to see cats with mild chronic kidney disease and hyperthyroid. The thing you have to keep in the back of your mind is they probably have significant kidney disease. It's just not reared its head yet because the thyroid hormone is kind of masking it. You can also see low potassium, high phosphorus, and sometimes an elevated blood sugar just due to chronic stress. So we've diagnosed them. We are going to start them